Americans who have health insurance still overpay. Not because insurance is expensive, but because of simple mistakes no one explains. Health insurance is supposed to protect you, but if you don't understand how it actually works, it can quietly drain your bank account. Today, we'll break down the most common health insurance mistakes Americans make and how to avoid them. Mistake number 1. Only looking at monthly premium. Most people choose a health insurance plan based on just one number, the monthly premium, but a low premium often hides higher deductibles, co-pays, and out-of-pocket costs. In the US, the cheapest plan can easily become the most expensive after one emergency. Mistake. #2. Not understanding the deductible. Your deductible is the amount you pay before insurance starts helping. Many Americans don't realize their deductible can be $5,000 or more. Seeing an out-of-network doctor, even by accident, can multiply your bill overnight. Some plans. Mistake 4. Skipping preventive care greater than. Many U.S. health plans cover preventive care for free. That's not a sales line. That's federal law. Annual physicals, routine blood work, cancer screenings, vaccines, blood pressure checks, cholesterol tests. $0 out of pocket, no deductible, no copay, no surprise bill. And yet, millions of Americans skip them every year. Why? Because they think, I feel fine. I don't want to deal with doctors. I'll go if something's wrong. I don't want to spend money. But here's the truth. Skipping preventive care doesn't save money. It delays problems until they're more expensive. High blood pressure doesn't hurt until it causes a stroke. High cholesterol doesn't feel bad until it causes a heart attack. Early stage cancer often has no symptoms until it's no longer early stage. Preventive care is where insurance works best. It's designed to catch small problems before they become life-altering ones. And from a financial standpoint, a free annual exam can prevent a $30,000 hospital stay, a $100,000 surgery, years of expensive medication, lost income from missed work. Skipping preventive care is like ignoring the check engine light because the car still drives. It doesn't mean nothing's wrong. It means you're choosing not to look. The smartest move? Use what you're already paying for. If your plan includes free preventive care, and most do take it, you already paid for it in your premium. Not using it is wasting money. Mistake 5. Choosing the wrong plan type greater than. HMO, PPO, EPO. These aren't just letters. They decide which doctors you can see, whether referrals are required, how much flexibility you have, how much you pay every month, how much you pay when something goes wrong. Let's break it down simply. HMO, Health Maintenance Organization. Lower monthly premiums, lower out-of-pocket costs, smaller networks. But there's a catch. You must choose a primary care doctor, get referrals to see specialists, stay inside the network. If you go outside the network, you usually pay everything. HMOs work best if you're healthy, you don't travel much, you're okay with fewer choices, your doctors are already in network. PPO, Preferred Provider Organization, higher premiums, higher deductibles, but more freedom. You can see specialists without referrals, go out of network, keep doctors. Even if they're not in your plan, PPOs cost more because flexibility costs money. They work best if you travel often, you want control over your care, you see multiple specialists. You don't want permission to see a doctor. EPO, Exclusive Provider Organization, a hybrid. Lower premiums like an HMO, no referrals like a PPO, but still no out-of-network coverage. EPOs are cheaper than PPOs but riskier if your doctors leave the network. Here's where people mess up. They choose a plan based on the lowest premium, a recommendation from a friend, a random option during open enrollment. I'll probably be fine, instead of asking, Do my doctors accept this plan? Do I need specialists? Do I travel out of state? How often do I use healthcare? Choosing the wrong plan type can cost thousands per year in out-of-network bills, denied claims, higher copays. Loss coverage. Health insurance isn't one size fits all. The best plan is the one that fits your actual life, not the cheapest one on paper. Mistake 6. Ignoring the out-of-pocket maximum greater than. This is the most important number in your policy. More important than your deductible. More important than your copays. More important than your premium. The out-of-pocket maximum is the ceiling. It's the most you'll pay in a year for covered services. Once you hit it, insurance pays 100%. No more copays, no more co-insurance, no more deductibles, and yet, most people don't know their number. They panic over bills they're actually protected from. They delay care because they think, I can't afford another appointment. I already spent too much this year. But if you're near your out-of-pocket max, that next appointment might be free. Here's how this mistake plays out. Someone has surgery, they get hospital bills, they get lab bills, they get anesthesia bills, they panic, they stop opening mail, they avoid follow-up care, they stress themselves sick. But if they had checked their policy, they know they already hit their max. Everything else that year is covered. Understanding this number reduces fear, prevents skipped care, helps you plan timing for procedures, protects your finances. If you're dealing with high medical costs, this number is your safety net. Know it. Track it. Use it. Mistake 7. Not reviewing plans every year greater than. Health insurance changes every year. Even if you don't change anything. Doctors leave networks. Hospitals renegotiate contracts. Drug formularies change. Premiums increase. Deductibles go up. Benefits shift quietly. The plan you loved last year might be terrible this year, but many people stay on autopilot. They click renew. They don't compare. They don't check providers. They don't reevaluate usage. That convenience can cost hundreds or thousands every year, especially if your doctor is no longer in network. Your medication is no longer covered. A cheaper plan now fits you better. Your health needs changed. Life changes fast. Marriage, new job, kids, chronic conditions, moving states, aging parents. Your insurance should change with your life. The smartest consumers review plans annually, compare total costs, not just premiums, check networks and medications, adjust coverage as needed. Staying informed is how you stop overpaying. The smartest Americans don't just buy health insurance. They understand it. Insurance companies count on confusion. Confusion leads to overpaying, underusing benefits, avoiding care, accepting bad plans, missing protections. Health insurance isn't confusing by accident. It's confusing because confusion is expensive. But knowledge flips the script. When you understand premiums, deductibles, networks, out-of-pocket maximums, plan types, you stop being reactive. You stop panicking. You start making strategic decisions. You turn insurance into what it's supposed to be. Protection, not a trap. Quick checklist: premium, deductible, network, out-of-pocket, max, plan type. If you know these 5 things, you already understand more than most people. Final message: you don't need to be an expert. You don't need to read every page of fine print. You just need to know what actually matters. Because one smart decision during open enrollment can save you more money than months of budgeting. Health insurance isn't confusing by accident. It's confusing because confusion is expensive. If this video saved you money, or could save you money, subscribe for more simple finance breakdowns. No jargon, no fear tactics. Just clarity.